We are Group 2, and the presenters will be Alex Calhoun, Jacob Huff, Dylan Rains, and Savannah Smith. Our goal for this video is to inform currently practicing physicians about the role physical therapists can play in combating the opioid crisis. Alex is now going to provide some background information concerning the statistics of opioid use. Following her, Jacob will discuss how these statistics are likely to change in the upcoming future if nothing is done to combat this crisis.
From 1999 to 2017, there were approximately 703,000 deaths that were from drug overdose. About 400,000 of those involved the use of opioids. In 2017 alone, about 70,000 drug overdose deaths occurred. 68% of those were involving opioids, while 60% of those were from synthetic opioids specifically. In 2016, roughly 11 million people 12 years old and older admitted to misusing opioids. From age 12 to 17, this was 891,000. From age 18 to 25, it was 2.5 million. Age 26 and older, it was 8.2 million. The majority of these people said they misused the opioids due to physical pain that they were trying to decrease.
The opioid crisis is expected to worsen during the next decade. From 2016 to 2025, 700,400 individuals in the United States are projected to die from opioid overdose. The annual number of opioid overdose deaths is projected to increase to 81,700 by 2025. A 61% projected increase in individuals using opioids from 2016 to 2025 is expected.
These numbers aren't meant to make you feel hopeless. We sincerely hope that the information provided here can act as a catalyst to create change. This opioid crisis isn't going to go away overnight. It's going to take a long time and a concentrated effort to make the changes that we need to see. So, how do we make these changes to combat this crisis? Physical therapy may be part of a potential answer. Savannah is now going to highlight some of the interventions that physical therapists can utilize to aid in pain relief, and I'll conclude the video by looking at the bigger picture of how physical therapists and physicians can work together to create the changes.
Patients want to understand their pain. Physical therapists can educate patients on pain physiology in a way that the patient will understand, including informing the patient of psychosocial influences on pain that they may not have considered before and techniques to combat these influences. Physical therapists use various pain modalities according to patient preference to reduce pain perception, including but not limited to those listed here. In addition, PTs are trained in manual therapy, which is a hands-on approach including massage, muscle energy, and mobilization to relieve pain, increase joint range of motion, and improve function. Lastly, PTs prescribe and monitor individualized exercise programs aimed at improving function. Exercise has been shown to decrease nociceptor excitability, increase peripheral inhibition, and stimulate healing of injured tissues. Neuromuscular re-education can help normalize movement patterns, which can reduce pain with movement. PTs offer a wide range of specialized care that can help patients manage their pain and improve their function at any point in the continuum of care.
While physical therapists have several methods of treating pain and possibly preventing the development of an opioid use disorder, we cannot do it alone. As a matter of fact, no single profession is able to combat the opioid crisis by themselves. A systematic review was published in 2018, and it concluded that a multidisciplinary approach involving physical therapists and physicians is the key in combating the opioid crisis. Physicians can prescribe an analgesic, which then allows a patient to perform physical therapy interventions. These interventions can lessen the intensity of the pain or can maybe even correct the source of the pain. A referral to PT should be made early though, as early referrals have been shown to reduce long-term opioid use and allow for a lower intensity opioid to be prescribed.